The rehabilitation of abnormal motor synergies post-stroke. Here we see the classic posturing of hemiplegia post-stroke. Notice that the arm is flexed at the elbow and the leg is extended. Also notice the patient is wearing a orthosis to prevent foot drop. It is believed that abnormal synergies between agonist and antagonist muscles, particularly flexors and extensors, is responsible for this presentation. Here we can see what that actually looks like in a mobile patient. Notice how he can't bend his knee because of the extensor abnormal synergy in the lower extremity. He has to swing the leg out laterally and bring it around so his foot doesn't drag, and he's still wearing his orthosis for foot drop. Now we amplify the effects of our rehabilitation exercises by cranial nerve neuromodulation and also transspinal direct current stimulation, which are applied during the exercises. Here is exercise 1. It's called a cross crawl maneuver. Opposite arm, opposite leg. This is to help start to repair the central pattern generators in the spinal cord. Here's exercise 2 on a whole body vibration unit, trying to start hip flexion and knee flexion. Patient starts by bending the knee, then does a hip flexion, bringing the knee up to the bar. Now he flexes the hip and holds the position as long as he can. Now we add hip extension, so the movement is hip flexion, knee flexion, hip extension. And that's the progression of the exercise. Here we see the improved quality of motion and the endurance with training with this exercise, breaking down the abnormal muscle synergies in the lower extremity. Here we see the improved quality of hip extension with training over about a 3-week period. Now let's see if this translates into better walking patterns, better gait patterns. This is his first attempt without the ankle orthosis. You can see he still circumducts the hip because we haven't completely broken down the abnormal synergy in the lower extremity. Here we see improvement again without the ankle orthosis, a more straightforward stride. You can see very little circumduction. Here he is near the end of our treatment with him. Notice very little circumflexion of the left leg. Again, he's not wearing an ankle orthosis, so we've improved his ability to hip flex, knee flex, and dorsiflex the foot.